I'm here today with Julia Pollock, and she was the ASRA president in 2011, 2012. And we're going to talk a little bit about Dr. Pollock and her time as ASRA president. So first of all, I'd like to ask you, Julie, why you? What was the path that led to you becoming ASRA president?
So I was very fortunate in my career. I came from a very strong legacy of regional anesthesia at Virginia Mason, and I was mentored um, really well by Gail Thompson and Manny Batra and Phil Breidenbaugh and Don Breidenbaugh and particularly Michael Mulroy. And those guys were so involved in ASRA in the formation and in the continuing excellence of the educational and research programs involved with ASRA that their enthusiasm was pretty infectious. And so they pulled me right into that part of the society. And it was very easy for me to be excited about the mission and to become involved because of the work that they and many others had done.
So, were there any particular disadvantages that you had, obstacles that you had to overcome?
I really don't think there were. I think that the legacy was strong. There weren't a lot of women there in the early days. So I learned a lot from Denise Waddell and Terry Horlocker and Kaiser Inneking, who were very important in the early development of ASRA. And perhaps people don't recognize what a groundbreaking legacy those women had. And so it was such a pleasure to be mentored by them. And I think Denise in particular, because she was the first female president, really paved the way for all the people who came later.
And you were only you're the third woman who was an ASRA president. Do you have any advice to other women to get along that path?
Well, I think if you certainly have to have a passion for that. If it's not your passion, it can be very time consuming, but if you're invested in the mission and you have a passion for that, it becomes a bit of a labor of love. And I think that is a very important component, because otherwise you can resent some of the time commitments. But if you believe in the mission, then it's totally worth it.
So can you recall what were the predominant needs or issues in ASRA at the time?
So this was fairly early in the evolution of ASRA as a very large educational society. So during the time that I was on the board, we transitioned to two separate meetings, one for pain, one for regional anesthesia, and a lot of weekend workshop type meetings. And so the educational program really grew a lot during the time that I was involved with ASRA. And the coordination of those was challenging, but there were a lot of people who were passionate about teaching regional anesthesia. So it was fairly easy to find people who wanted to be involved in those opportunities.
Can you tell us a little bit about some of the challenges that you encountered when you were at ASRA?
So organizationally, anytime you're putting on a large educational program, that is very challenging, because not everybody wants to learn about the same sort of things. And so figuring out what the member needs are and really addressing those in a way that can benefit the largest number of people, I think is probably one of the big educational challenges, or one of the challenges to having an educational society. The other thing is the society grew very rapidly, and it was difficult to kind of balance the needs of both the regional program group as well as the pain group, and make sure that everybody's educational needs were addressed, because they're different. They're a little bit different.
Yeah, it sounds like you were president at a time when regional anesthesia sort of kind of exploded into the masses, and everybody wanted to learn, particularly ultrasound guided regional anesthesia. And do you feel like the specialty of anesthesiology was ready for what ASRA had to offer at the time?
I do think there was a lot of interest in learning about in regional anesthesia in general, and then absolutely in ultrasound. And one of the things, and ASRA owes a huge debt to Vince Chan for the development of a lot of that expertise and technology. And there were many people who were already in practice and didn't have the opportunity to learn that as a resident or as a fellow. So all those people looked to ASRA actually to learn how to do those things. And it was a great opportunity, and it provided a lot of rich educational material that people were really anxious to partake in. And so there was a lot of participation, and a lot of people were really anxious to come, not just to the lectures, but specifically to the workshops, to get their hands on an ultrasound and to experience how you could benefit, or how your patients could benefit from learning about those techniques.
So you mentioned some of your mentors that sort of brought you along in this
A
regard.
long list, isn't it?
Yeah, it is. Can you think of someone who you found it particularly valuable to listen to during your time as president?
So Mike Mulray is probably has been my strongest mentor, my most passionate advocate. And, the amazing thing about Mike is he never lost his passion for education and his willingness to be involved. And he always was looking for another opportunity to teach people more. And I still hear his voice. I think this is true of everyone who trained under Mike. You still hear his voice in your head at some point telling you something about anesthesia or regional anesthesia. And I still hear his voice in my head telling me things about being a leader or administrative work or other things like that. And so he's without a doubt a really amazing mentor to me. I had a very strong peer group as well. Dan Kopaz was a peer of mine, as was Joe Neal, as was Chris Bernards. And they were really great advocates. They were all regional fellows together, and they were really strong advocates for regional anesthesia. And they were very beneficial to me in terms of advice, particularly about research, but about a lot of other things involving regional anesthesia as well.
So do you feel that there were specific changes in thinking or practice or attitude that you tried to foster during your time as ASRA president?
So I think if I had one thing that I tried to foster, it was accessibility of the educational material offered by ASRA to just private practitioners in general. I do think it is difficult for private practitioners to be involved in an educational society. It's difficult to get time off to go to a meeting. And sometimes it's hard to be the only person in your practice who's interested in doing regional anesthesia, particularly if you don't have a foundation in your group. If your group doesn't have a pain service or an epidural management service, it's really hard to be the first person in your group to go in and try to do that sort of thing. So I felt very strongly that those people needed a lot of support and opportunities to learn how they could do regional anesthesia most easily without causing a huge disruption to the rest of their practice, and also so that they wouldn't feel burdened by trying to initiate those sort of practices.
So yeah, there seems to be somewhat of a disconnect between academia, where there's this, all these fancy blocks, more peripheral blocks, more targeted blocks, and sort of the attitude in private practice, which is more based on production.
Yeah,
and,
absolutely.
So how do you feel ASRA has addressed that particular sort of disconnect?
Well, I think ASRA has tried to do that. I think the workshops are geared to simply learning how to do the blocks, and those are great for private practitioners, or they can be. It also, one of the other things I think that ASRA has tried to do is educate people on the benefits of regional anesthesia, so they can take that to their skeptical surgeon and talk about some of those benefits and try to initiate that stuff in their practice. And sometimes it's very difficult to bring some of those guys along. They're operating with a different set of data, a different set of research, a different set of expectations, a different set of experiences from where they trained. And so sometimes it's really challenging to do that. So I do think ASRA tries to at least offer them the educational opportunities to have a critical conversation with a surgeon about the potential benefits for their patient, and also to maybe show people how to do some of the simpler blocks that aren't so complicated, that don't take a long time, that you don't have to have a lot of special equipment for.
So you mentioned that there's a great time commitment involved. And how do you feel the rest of the people in your department responded to your commitment to ASRA particularly with the time?
So my department's a little different because at the time I was at Virginia Mason, and you do that on your own time. You do that with your vacation time or your non-clinical time or your post-call time. So it does not really impact the other members of the group. But I had seen other people before me, as I mentioned, make that commitment and be willing to do that and make those sacrifices for the educational mission of ASRA and for the educational mission of the department. And so there was a very strong legacy and a willingness to do that. So I think it was just part of what we did there.
And I think to this point, 6 of the modern era ASRA presidents of 31 have been from Virginia Mason. What do you think the advantages and disadvantages of having such a Virginia Mason influence on ASRA have been?
Well, I think, as I mentioned, there's a lot of positive things, right? There's those early pioneers set the bar very high for the level of commitment that people would have to ASRA. So I think that ASRA benefited greatly from that. Virginia Mason's also special in that there was a very strong, as you know, a very strong legacy of the use of regional anesthesia. And so it's easy to do those things there. And so in some ways, maybe that is a little bit of a detriment because maybe as presidents of ASRA from Virginia Mason, we didn't always understand how difficult it might be to do those things coming from other places.
Good point. So just to finish up here, what words would you choose to define ASRA?
So I think ASRA has a really important mission, and I think they've always really addressed that so well, and that's the mission of ongoing education, as well as research, which is, they provide research funding and avenues for people to present their research, but really it's about the education, and it's education for residents, it's education for fellows, it's education for people that are already in practice. And I think that is such a wonderful and proud legacy. And I think they've really answered the call on that year after year after year. And I think that's something to really be proud of.
Well, thank you, Dr. Pollock. We
Thank
really
you,
appreciate
Dr.
your time.
Harrington.
It wouldn't be complete without your input.